It's an enormous honour for me to read the citation introducing Professor John Michael Gaziano to the fellowship as a distinguished foreign fellow. I've known Michael for about 20 years now by research reputation and about 10 years by collaboration. And he really is one of the stars of US research in cardiology, epidemiology and prevention, the importance of which we've just heard about from Tony Rudd. Professor Gaziano is Professor of Medicine at Harvard Medical School and head of the Division of Aging at Brigham and Women's Hospital in Boston. He's a practicing physician and a world-leading researcher in the epidemiology of vascular disease, large-scale clinical trials and preventive epidemiology. He graduated in medicine from Yale in 1987, trained in medicine and cardiology, and obtained his Master's in Public Health from Harvard in 1993. Rapidly thereafter, he established an international reputation for his research, and he has the vision to recognise important questions, the ability to answer them reliably, and the clinical grounding, I think, crucially, to translate complex research evidence into practical clinical strategies, which he applies himself in his own clinical work. He's made an enormous number of contributions, and I just, for the sake of brevity, highlight his work on the interactions between lifestyle, biochemical and genetic risk factors in vascular disease and cancer. He's conducted large-scale randomised trials at very low cost in the US system, including trials of aspirin in primary prevention of vascular disease and vitamins in prevention of cancer, all of which has influenced clinical practice in the UK and around the world, as well as in the US. And also his innovations in embedding research within the US healthcare system, particularly taking advantage of the Veterans Administration system. He's also made a remarkable contribution to the research infrastructure in the US. He established the Massachusetts Veterans Epidemiology Research and Information Center, Maverick, very impressive endeavour, which under his leadership has grown to a faculty now of 140 staff and an annual budget of 20 million, and is an incredibly powerful research engine. He's also director of the Physicians' Health Study, the Women's Health Study in the US, and recently established the Million Veterans Programme, which is a visionary equivalent of our UK biobank, with 1 million veterans stored biological data and long-term follow-up, which I think, like the biobank, will become one of the most important engines for discovery in epidemiology and genetics over the coming decades. That's taken an enormous breadth of expertise from the basic biology required to establish the biobank to the epidemiology to organise the follow-up and sort out the outcomes. He's translated this work so far into over 500 publications with 25,000 citations, and maintained this output despite running a major academic department, a very substantial clinical practice, major editorial roles, including the editorship of JAMA, and remarkably also a number of quite significant clinical teaching duties at several institutions in Boston. All in all, I think a remarkably rounded contribution and a very worthy recipient of our distinguished foreign fellowship. So commended to the fellows and to the President.